I just wanted to, before talking about our vaccine numbers and so forth, wanted to show you where we stand in terms of our community transmission levels. We have talked about this before. When we look at these are the test positivity numbers, Montgomery County is at 2.02%. We actually yesterday dropped below, the day before we're below 2. And so our average, the state average is at 3.69. And you see where we stand in comparison to all of the other counties. I believe we are only second to Kent County in terms of test positivity numbers. When we similarly, when we look at our case rates compared to other jurisdictions, you can see this is where we were yesterday. Our case rate has dropped to 6.64 cases per 100,000 residents, and you can see how we stack up against other counties across the state. So to pivot within that, a couple of general announcements before talking about vaccines. We obviously continue to monitor our community transmission numbers, continue to look at the impact of variant strains within our community. We do know that the B117 or the UK variant continues to be the predominant strain, although there has been reports of an uptick in cases of the Brazilian variant or the P1 variant of COVID-19. We again have had all cases, including all of those different variants reported throughout our community. So let's move through our slides go through this fairly quickly to save room for questions and discussions. This is, again, another schematic to show our community transmission levels in terms of our case rate. You can see that we are continuing to see
Dr. Gales, would you mind?
I can't hear you.
Can you make it in view mode, like a full screen, just so you know? Are you able to do that? Okay, maybe not. All right, don't worry about it. It's a little.
Might be on our end.
Yeah. Okay. Thank you.
Are you able to help with that?
Thank you.
Is that better?
Yes.
Okay. All right. Sorry about that. Part of the challenge is this file is extremely large, and it's, I think, about a 12 megabyte file that makes it impossible to download into the PowerPoint. So here we are for our transmission levels. You can see we're seeing and continuing to see improvements there. When we look at our vaccine numbers, we have continued to make improvement in terms of the percentage of our residents covered. We've got 54% of our residents having received at least one dose. And again, this information is pulled from our Immunet data in Maryland. We try to reconcile a number of different sources, including our state data, as well as that with CDC to get a good number. But this is pulled from CRISP and Immunet. We've got 54% of our residents having received at least one dose. The statewide average is 45%. And we now have hit over 38% of our residents being fully vaccinated, having received both doses or the single Johnson & Johnson dose, compared to 32% by the state. And then you see how we stack up against other counties across the state on the right side. And then you see the percentage breakdown for our younger populations. Now, this is of importance because we've had great success in getting our older populations covered. We now have, we see close to 80% of those age groups being fully vaccinated. We're continuing to see increases in the percentage for the 40 to 64-year-old group. The area that seems to be lagging behind is our 17 to 39-year-olds. And we actually see a good, the 17 and up being, the 17-year-olds, we are seeing a good number of those getting covered. Now, we only currently have one vaccine, again, that has been approved for 16 and up. That's Pfizer. There was an announcement yesterday that the FDA will likely have their hearing for their EUA hearing to get that age limit dropped to 12, potentially as early as next week. And we continue to work behind the scenes with our community partners and our partners in education, both non-public and public schools, devise some strategies around being able to provide some vaccine opportunities to those younger groups. I think we'll probably have more success with those groups, and that donut group, if you will continue to be that middle age population who's not coming in. So probably early 20s to mid 30s, we've got to figure out some strategies to convince them to come in and get vaccinated for additional coverage. This just shows you the running total of vaccines that we've administered so far in terms of number and volume. Again, this breaks down the primary sites where people are accessing and getting their vaccines. Continues to be the county apparatus in terms of the different sites, as well as our mass vac site in Germantown. And this breaks down the distribution by each week by age. And as we can see now, again, this makes perfect sense because we pretty much saturated the older populations since we hit them first. And we're starting to see an uptick in the younger groups come in and get vaccinated. We certainly need to see even more of those folks coming in so we can increase the percentage of our residents covered. This breaks down vaccine rates by race and ethnicity, looking at it by age group. You can see that the gaps between groups has continued to shrink significantly when comparing white residents versus Black residents and white residents versus our Hispanic residents. This is our geographic breakdown again, and we are working to focus on those zip codes that remain in the red to do some focused outreach efforts to get folks vaccinated and to understand why those numbers lag behind the rest of the county. And similarly, those focused efforts are undergoing to address those under 65 as well. This is just another geographic representation looking at the percentage of those who've received the first dose, comparing it also to the percentage of those who've been fully vaccinated. We did talk previously, we put a lot of energy into pre-registration because we were utilizing an appointment system given the lower supply of doses available. Now, as Dr. Stoddard will likely share with you some more details about our shift in scheduling, we have pretty much gone through and exhausted the pre-registration list that we have for the county, as well as the pre-registration list provided to us by the state. And we will be pivoting to a new type of scheduling that basically is equivalent to walk-up availability for vaccines at the different sites. We did do a bit of a pilot project with that on yesterday at our mass vac site using Johnson & Johnson doses. And I want to say we vaccinated over 400 individuals using that platform. And so we will be releasing more details about that and how community members will be able to access all of the different sites utilizing that type of strategy. We continue to prioritize equity, again, looking at our top tier zip codes based upon the impact of community transmission and COVID-related illness. And that actually concludes the slideshow. And I learned a new trick today in terms of using F11 on your screen to blow it up. Learning never stops. And I think the other updates to put out there, we continue since we last met. Obviously, the Johnson & Johnson doses were approved for use. We, as the health department, did not receive any further doses of the Johnson & Johnson dose last week. We did see an increase in our doses back to 9,000 doses for the local health department. All of our doses have been Pfizer and Moderna. There were approximately 16,000 Johnson & Johnson doses, I think 16,800 Johnson & Johnson doses sent from the state to different entities across the state, including hospitals and other places. And I think maybe a couple hundred of those doses went to one health department, but the overall majority did not make it to the health departments in this turn. And we don't have any further information, or at least I don't have any further information in terms of what the longer term strategy will be in terms of utilizing Johnson & Johnson doses for that. I would also like to emphasize that, and we've talked a lot about this before, is our efforts to provide vaccination to our homebound population. As you recall from last week's conversation, we surveyed all of the folks who had indicated, or the folks that we had information for in our pre-registration information who indicated homebound status. And we surveyed them to get an understanding if they still needed a vaccine. And we did that both through email as well as through phone call. And we broke it let down by individuals who still need vaccines, who live in those priority zip codes versus those who don't. And we are staffing up in partnership with our colleagues in aging and disability to be able to support that effort towards the end of the week to continue to make our way through that list. I think we identified close to 200 individuals who answered the survey and we were able to contact and get in touch with to be able to provide those vaccines with, primarily utilizing the Johnson & Johnson doses. As you recall, we had 284 of those doses remaining from when there was a pause, and we'll use that tranche of doses to get that first wave of folks who we've been able to successfully contact, get them vaccinated again, hopefully by the end of the week. We continue to support our community partners in terms of providing doses to support their efforts to get folks vaccinated in the community through, again, a diverse set of locations as well as measures. And as pointed out, we are in ongoing discussions to figure out how to create some opportunities that are youth and adolescent focused to get our younger population vaccinated. I know that there's been discussions related to that involving the communications aspect, and our team has been working on looking at logistics in terms of how to best be able to provide that, whether that would be going to schools directly or creating central sites for adolescents and young adults to come in. We're also continuing to work with our team around issues around consent to make sure that all of those issues are taken care of so that the process is seamless and smooth for young people being able to come in and access that opportunity. I will stop there. Dr. Bridgers, did I miss anything from public health side?
Good morning, all. Dr. Gale, I think you covered everything. The only thing that I would add to our homebound vaccination strategy is follow up to, council's ask last week, and in particular, Councilmember Rice. We did reach out over the weekend to those non-governmental organizations and all of those organizations that provide services to homebound individuals. We're working with our agency and disability services. So not only looking at those individuals who are homebound, but they're caretakers as well. And so as Dr. Gales indicated, based on the amount of vaccines that we have remaining, remember we had 280 doses of the Johnson & Johnson vaccine remaining before the pause in their administration. We've identified 211 folks who are immediately ready to get vaccinated, and our team is reaching out to them. Testing still continues to be part of our equation. So to all those listeners who haven't gotten vaccinated and you are in the community, please consider getting tested if you feel sick or are symptomatic, and encourage others to get tested as we collaboratively work through this. I'll stop there. Subject to any questions, Dr. Gales, I need to depart from this call and go to another call. Thank you.
Thank you, Dr. Bridgers. Dr. Stoddard?
Good morning. Good morning. I only have a few pieces to add, just a little more details about the mass vaccination site. So we began the week this week at the mass vaccination site with approximately 3,600 doses of Pfizer vaccine, 2,700 doses of Moderna vaccine, and 1,300 Johnson & Johnson doses left over from before the pause. Yesterday, so actually, when I say began the week, we actually received the Pfizer and Moderna doses yesterday afternoon, I believe, and are utilizing them beginning today. So yesterday, all we had was Johnson & Johnson. We did have an opportunity to have 1,300 appointments made, but we only had about 393 people show up yesterday. So it tells you that there is still some hesitancy around the Johnson & Johnson vaccine particularly. I am pleased to say, though, that the remainder of the clinics, which were scheduled with Pfizer through the rest of the week, have been filling up, and they have, I think, approximately 1,300 appointments per day. And I think most of the days are over, 1,000 appointments already. At least today, we're already over 1,000 appointments. We'll take a remainder of walk-ups that we've already started to receive as of 4 minutes ago.
I'm having trouble hearing you. I don't know if you could lean a little closer to the mic. I'm sorry, I just can't hear you.
Yeah, so we got 1,300 doses a day at Pfizer for the rest of the week, at least through into Friday. Then we'll move over to the Moderna either on Friday or on Monday, depending on how fast the uptake of the Pfizer vaccine is this week. We will do walk-ups every day, 10 to 2:30 every day at the Montgomery College Germantown site. So people are welcome to just, if you want to make an appointment, you won't have to wait in line when you arrive. You'll go right into your appointment time. If you just want to, if you have a few minutes at your lunch break and you want to run over and get vaccinated, we're going to accommodate you there too. So obviously, we are interested in getting people in to be vaccinated. The one thing I will note in this, Councilmember Reamer, in response to your inquiry this morning, we have, looking at the vaccination numbers, I compared our Monday through Sunday total last week with the previous 5 weeks before that. And in total, so week over week, last week, we saw a 19% reduction in vaccine uptake across all sources, not just the county, all county residents uptake compared to the previous week, and a 25% reduction from the average of the previous 5 weeks before that. And so this is consistent with numbers that are being seen across the country. So this is not a Montgomery County specific phenomenon. We are seeing a reduction in vaccine uptake, and I speculate that it's, number one, the people who were really gung-ho to get the vaccine have largely gotten it. And now we're moving into that next tier, which is not necessarily the people who are hesitant, but the people who have other barriers or impediments, or for whom there isn't the same sense of urgency to get vaccinated that the first group included. And so, to be clear, I don't think we're in this population. We are certainly dealing with the population that says, I don't want to be vaccinated, and we're trying to encourage them to be vaccinated. But I also think intermixed among them are people who are willing to be vaccinated if the opportunity is made more convenient, closer to them, easier to access, time, hours of operation are better, weekends, all those things where we're trying to broaden the opportunities at all the sites, while simultaneously, as Dr. Gales alluded to, getting closer into where people live and work. And so we're doing both of those things concurrently. I think that will help us continue to move forward, but maybe not at the pace that we had been 4 weeks ago. And so I think that's all I wanted to cover this morning. And I think we're happy to take any questions.
Thank you so much. Councilmember Rice.
Thank you very much, Mr. President. And unfortunately, Dr. Bridgers stepped off before I could thank him directly. But really want to thank all of you for continuing to provide ways in which some of our homebound, some of our folks that are out there continue to get connected and utilizing the resources of folks that are out there working with this population. So again, just want to thank you and say job well done. I did want to follow up on something that I saw in the District of Columbia, and just wondering what we may be doing here with regards to, and I'll take it twofold. One, for businesses who are now looking at requirements for folks vaccinated and looking at proof of vaccination. So wanted to see what our thoughts are here, but then also when it comes to the businesses themselves and requiring proof of vaccination for their employees. So not just for patrons, but for employees as well. So if you could just share with me the thoughts around this and where you think jurisdictions are headed, where the state of Maryland may be headed. I know that I just saw the governor announced that he's now providing $100 incentives to employees to become vaccinated. And so I know there's a big push for employees to be vaccinated, whether it's incentivizing them via pay or requirements. Can you just share a little bit about what the thoughts may be there?
Thank you, Councilmember Rice, for the question. You have actually touched on an area that I think we'll be interested to see how it rolls out in terms of how to leverage technology and in terms of vaccine confirmation, whether it's restaurants or travel or work. And that is an open market right now where there are lots of different, I think, options that have been put forward. I know that, for example, I believe it's St. Mary's County has tried using a technology platform within that, and we've been investigating that, looking into that. We've also pushed this, as in all of our efforts, we always ask the state if the state is going to take a larger effort for sake of standardization and uniformity across the state. And I don't have any further details to say, the state is looking at this particular option, but it is something that we're looking into. The DC platform is something else I, happened to read about yesterday and was made aware of over the weekend. And we're looking into that to see would that be feasible to do on a county level. And also if and when the state is going to do something, if it would be complementary to whatever is put in place there. And I think from the perspective of work, I'm not an attorney, so I won't get into, I'll try not to step into to that. I do think that I don't know all the parameters of, employees being able to require and mandate their staff to have the vaccine. I do know that they are able to ask, the status if an individual is vaccinated. I'm not sure of all of the different parameters around, requiring that. And then, but to the piece about being able to follow and track, right now, even in the absence of technology, folks still do have their vaccine cards and are able to confirm their vaccine status through that way.
Well, thank you very much for that. And just my last quick question is just going to be around Pfizer and for our younger cohorts. I hear that the FDA may sometime this week come up with some guidance. And so my question is, do we now pre-plan by opening up a pre-registration portal for those that are of that 12 to 15 cohort? And the only reason why I ask this is we are looking at summer school. And we just heard from MCPS that summer school will be the most robust opportunity. I know that many of us who are parents or have children or know of children who are in the system, we just got updates yesterday and a portal was opened up for that summer school. We're preparing for the fall. And so from that, I know many parents are anxious. Summer camps that are out there and different types of programs. Folks are really inching for that opportunity. And so from that perspective, would that be something that we could go ahead and start doing just to make sure that when it does happen, we'll already have a robust cohort of folks that we can go ahead and reach out to and schedule appointments for?
Well, I hope this is an answer you like, Councilmember Rice. We are already working on that, and we had engaged with our colleagues in MCPS, as well as we did have some outreach from at least one of our networks of non-public schools to engage in that conversation. And so the team we did discuss this morning, in fact, with that news, to look through some different strategies. And I know that Councilmember Reamer had brought this up in previous conversation, Councilmember Albanos. So we're looking at trying to figure out the best way to do that and deliver, particularly given, as Dr. Stoddard mentioned, a shift to a walk-up type scheduling mechanism. So stay tuned. It is being worked on, and certainly we will be reaching out to you all for some ideas and input as we flesh some of those logistical details out more.
I would just add that because we know it's only Pfizer, and so the shifting of the Moderna for those that are older, and I'm not going to get into what you guys do in terms of your planning because you do such a great job of it. But certainly one in which, from a regional logistical perspective, we need to consider that as well, because again, these are children who aren't going to be able to drive anywhere, so they'll likely have to have their parents that are taking them. Some will need public transportation, and so from that perspective, logistics will be a challenge, and so it will be important for us to have it at multiple areas. And so that's why having the pre-registration or having that kind of understanding of where the folks are who want it will help us in being able to deliver it effectively, understanding this is a different group from what we've had before to where we can expect folks to be able to go all around. So just wanted to share that with you, but I know you guys, thank you for doing the work behind the scenes and making it happen. I really appreciate it. Thank you very much, Mr. President. Back to you, sir.
Thank you. Council Vice President Albornoz.
Thank you so much. I want to pick up where, I want a personal note. I got my second shot on Friday, had no symptoms. My arm was just a tiny bit sore, but no more sore than it is when I got my flu shot, or when I get my flu shot every year. And I know it has impacted people differently. And I've also heard that there's some folks who may be reluctant to get their second shot, at least in part, because of the negative stories they've heard among friends or family members who got a little bit sick, after the second shot. I'm just happy to report I didn't get sick. I still would have gotten it even if I had, but just want to counter some of the challenging stories out there with positive ones. So want to make sure our residents know that. And I should note, my parents also did not experience any symptoms after their second shots either. So it impacts people differently. I just want to pick up where Councilmember Rice left off. Obviously, tremendous news that is early as a week from now, we may be able to start vaccinating children as young as 12. We're uniquely positioned here to have a pediatrician as the director of our public health infrastructure. Dr. Garrels, are we working with pediatricians? Because I know parents are probably going to have questions. And it's to Councilmember Rice's point, there's unique challenges with every demographic as they, go through the logistics of trying to secure the vaccination. In this case, there may be some additional questions that families and parents maybe feel most comfortable asking the pediatricians. Has there been talk of any alliance there with our providers, with our medical providers?
Sure. Well, the state has actually been actively working with the pediatric community around messaging and, to your point, to get, make sure that population has adequate information. We haven't had as much local outreach given the efforts from the state in working with the different professional societies around that. And to your other point too, hopefully that we will see a further increase in the amount of doses so that potentially pediatric providers will be able to have doses in their offices, recognizing that you mentioned a lot of folks do feel more comfortable going to their personal pediatrician as opposed to, it might be a little bit more intimidating or off-putting to go to a larger site and be more, impersonal in that setting. So there's a couple efforts, including the increased education, encouraging pediatric providers to, register and make sure they have vaccine on site in their offices as an additional resource for parents to be able to take their kids to get the vaccine.
Thank you. That's really helpful. I think those are all my questions for now. I'll yield back to you, Mr. President.
Thank you so much. Councilmember Reamer.
Thank you. Thank you very much. On the homebound seniors, if I understood what you said, Dr. Stoddard, or maybe Dr. Gales, we have worked our way through the whole list. I just asked because I have been in dialogue with a resident who's trying to get their parent a homebound visit and hasn't received any contact. So could you give us a quick summary again of the homebound and what should someone do now if that is their status?
Sure. Thank you, Councilmember Reamer. So we've worked through the names that we have through our pre-registration portal that that we're collecting that way. And so if there is still someone who is working through trying to get a vaccine, I'm sorry that it's taken some time, but if you will provide us with their information, we'll make sure to include them and have members of our scheduling team reach out to them to make sure that they're included in the list.
Okay, thank you very much. Good conversation here on students, and thank you for continuing your work to build a plan there. I'd like to make the suggestion that we think about how to really motivate kids at this time to get vaccinated themselves and to even make their families want to bring them to get vaccinated. What if we were to offer free movie passes and free meals at like a pizza restaurant or a local, restaurant of which that kids love, that they're all around the county, for kids who go in to get their vaccination. 16 and ups, they can if I understand it correctly, they don't need parental permission. So our high school students could take advantage of the opportunity on their own volition. They could turn it into, a Friday afternoon. We're all going to get our shots, and then we're going to go out and get a movie, and we're going to get a meal. And then the younger kids, as that opens up, it could be something where all the kids are coming home to their parents and saying, mom and dad, like, can we do this? So I tried to just crunch the numbers. If we budgeted $15 a student and we got, 30,000 students, it's only a couple $100,000. Seems like that would be well worthwhile expenditure given the critical demographic that we're trying to target. And I think the fact as we're seeing from the changing pace of vaccinations, as you've said, we're going to have to work harder now. The easier, not that anything was easy, but the easier part in a sense is sort of behind us. The harder part is ahead of us, and we're probably going to need to work harder, to get all the way to the finish line. So I've been in a planning process with the vaccine hunters, and they are very excited about, as teachers, bringing home some of that work to the school community, as well as other efforts to kind of create more community excitement about coming out and getting vaccinated. And we came up with this idea of providing an incentive, and I just was curious if that was something we could explore as a follow-up. And you're already building the groundwork with some of the transportation logistics and things like that. But we've seen New Jersey have a similar measure targeted towards more young adults with a free beer from a local brewery, which would be cool if we could do that too. But I thought maybe starting with kids might be the most appropriate place to start for us, because we've got a very limited window before they sort of disperse for the summer, recognizing that we'll be able to reach some through summer camps. But anyway, any planning that you might, or any comments you have or planning you might want to share about that, and I'd love to follow up with you in the Vaccine Hunters to talk about how we might be able to work on something like that.
Well, as you referenced, there are a lot of different locales that are using a host of different incentives to encourage vaccination. From West Virginia, I think the governor is providing $100 savings bonds to folks, and a free beer in New Jersey. So there's variation within that. Incentives do have a role in that and can be impactful. I think we're waiting to see if a few more data points in terms of how it works in terms of the vaccine space. But as far as our team, we've been focused entirely on the logistical aspect of things and scheduling. We haven't had any conversations about utilization of incentives, but we'd be happy to talk with you offline about it more and what that could potentially look like.
Cool. Thank you. I'll follow up. Lastly, case rates are declining. It's so welcome. I hope this progress continues, and we'll obviously see as we progress through May, where cases are. But it is such a relief to see this downward trend and to be well below 100. Which it was concerning that we were continuing to be above 100. But to see us on that downward path now, I'm very hopeful about where we'll be by the end of May. I think we'll want to try to think, weeks ahead of that. But if that's where we seem to be heading, to a very low number by the end of May, I think we we'll need to revise our framework again. But thank you very much.
Thank you, Councilmember. Councilmember Friedson.
Thank you. Echoing the comments everyone has made, it's exciting that we're getting ready as a country to start potentially vaccinating young people and expanding the eligibility. Great to see the numbers in Montgomery County in particular where they are, a testament to folks following public health guidance. That they're only as good as those who are willing to adhere to them. And so the sacrifice that residents are making, businesses are making, we can't say it enough. That is what is working and has to continue. We hope it will continue, and just wanted to thank all of our residents, all of our businesses for all of their efforts. I did have a quick question on the vaccinations out of state. I know, Dr. Stoddard, you were working on taking a look at the CDC numbers and going through that. Just wanted to see if we could get a status report to see, the good news is 38% according to our numbers of those in the state of Maryland have been vaccinated. If we include those who've been vaccinated in other states, DC, Virginia, and elsewhere, that number is likely to be higher, potentially significantly higher. And so I just wanted to check to see where that effort was.
Yes, that number is 42.3%. As Dr. Gales alluded to when he was talking through, we are reconciling the two difference. And I think we're inclined to utilize a number that we believe is more accurate, which if they are accounting for out of state and federal vaccination efforts that are not included in the state Immunet number. So in terms of displaying on the website, the only trouble there is that we lose, if we eliminate utilizing state Immunet data, we lose the ability to do the bifurcation by age group and other things like that. And so we probably just need to include both, and that's what we're working on. So you can see the more detailed Immunet data where you can go in and see slices of age categories and racial demographics and all of those other things, whereas the CDC has a better full population number, but does not break it down in the same ways by race and ethnicity and age and things like that we want to be able to see. And so I think we're trying to figure out how we can utilize both numbers to tell different stories or to tell a more complete story. But I think in terms of the Board of Health regulation, we're inclined to use the CDC number, not because it's higher and higher is better, but because I think it actually more accurately portrays the full vaccination efforts that are undergoing in our community, whereby a lot of our residents are accessing opportunities in the district, in Northern Virginia, through federal partners and other places. So that number is 42.3%. So obviously it's about 4.4% higher than our current number is.
Appreciate it. Well, that is great. I totally understand the need to disaggregate the data and have the more detailed data, which we only have from the state. We worked very hard as a county and as a council and executive and health department to get the disaggregated data from the state. So wouldn't want to lose that. It's, I think, been key to your efforts to target populations and make sure that we're hitting the entire community. And so I wouldn't want to lose that, but I do think if we're using the CDC number, which seems appropriate since it appears to be the most accurate available number that we have, and that's what is being connected to the health order, that we ought to display it sooner rather than later.
I will note, for the purposes of the regulation, though, the CDC number says fully vaccinated, just the way our webpage did previously. When they say fully vaccinated on the page with the vaccination, if you go down into the details, it's actually those who have completed their dose schedule, not the 2 weeks thereafter that we need to that we require for fully vaccinated. So interestingly,
so at
even on the CDC page,
42.3%, we'd have to be at 50% plus 2 weeks, just to be clear for those.
Correct. I wanted to make sure that was one of the big details we wanted to make sure on, because obviously when CDC says fully vaccinated, I would think that they would want to follow their own definition, but they're actually not. If you read further down or on the page or on the descriptions of the actual metrics, it is actually just having received full dose complement.
Great. Okay, and I know the website has been updated to refer to it as the full dose schedule as opposed to fully vaccinated, which would.
Our page has, the CDC page still says fully vaccinated, though.
Right. I just
good.
Thanking you for the change to our website to clarify, because we have to hit 50% and then add 2 weeks, and that's when we would get to the final phase. The young people, as that happens, I do think there's an opportunity. I'll allow for Councilmember Reamer's idea to be vetted and thought through. But I think the broader point of the schools being a key point of entry that we have that's fleeting in June, if we could work hard with the school system to come up with a strategy of reaching those, now that it seems like we're turning the corner of potentially having more doses and available vaccines, then reaching these young people as early as we can, particularly when we have them in one concentrated area and a single point of entry, would really make a huge difference. I hope we can continue with those conversations and move forward in that direction. So thank you. And with that, yield back to you, Mr. President.
Thank you. Councilmember Glass.
Thank you very much, Mr. President. And just like Councilmember Albernaz last week getting a second shot, I too got my second shot last Thursday, and I got it at the Silver Spring Civic Building, and wanted to wait until more residents had been vaccinated until they opened up availability to all adults, and I wanted to do it at a county facility as well to see how those operations were running. And I'm pleased to say that the operation ran very smoothly and efficiently, and that everybody who was there was very helpful and seemed to be glad to be there, recognizing that they were helping, ensure the health and safety of all of our residents here in Montgomery County. And so I just want to thank you both for being here and for all of these conversations and for the ups and downs and sideways that had occurred over this last year, having not had a roadmap to get us to this point where 54% of Montgomery County residents have now received at least one dose and 38% have been fully vaccinated. So it is a testament to the nimble nature of county government, and of course also President Biden and fulfilling and exceeding his pledge to get more vaccinations in the arms of all Americans. And lastly, I just want to thank particularly the Medical Reserve Corps, a group of volunteers who've been doing yeoman's work. And each time I got vaccinated, I had really nice conversations with neighbors and friends and just regular county residents who are volunteering their time to help put shots in people's arms and to help the system operate. And so thank you to everybody who's helping out in that volunteer capacity. But back to the numbers real quick. The only question I have, so the update today was 54% of Montgomery County residents have received at least one dose, and 38% have been fully vaccinated. And last week, it was slightly more than 50% who had received one dose and 34% who had been fully vaccinated. So clearly a 3 to 4 point increase over the last week. And so the question that I've gotten from so many people is, when are we expected to reach the 60% threshold for first dose, which we codified as a benchmark in our health order last week? So Dr. Stoddard or Dr. Gales, what are the trend lines for getting us to that 60% magic number?
Thank you, Councilmember Glass, for your question. Utilizing the numbers that you shared with us, and in concert with the fact that we have seen some decreases in terms of folks coming through the doors, if you will, in terms of demand for the first dose, I suspect that we'll probably see more of a bump in the fully vaccinated number, at least in the short term, because all of those folks who a month ago or 3 weeks ago who came through the gates to get vaccinated will be getting their second shot. And the challenge will be getting that first number to increase more, which means we're bringing more people in. So if we're increasing by, I think we had been a little bit more bearish in terms of our prediction. If we're increasing by 3 to 4% on a weekly basis, you're looking at probably a 2 to 3 week window. Given where we are now, 54%, I would speculate, given one of the things that has changed for the good part of that is that, our allocation of doses increased from 7,000 to 9,000. So we're getting more doses now into circulation, which hopefully means more doses into arms. So I think we're probably looking at a 7 to 10 day period at the earliest, best case scenario, before we would hit that 60% marker.
And I functionally think what's happening is actually what we're going to actually see is maybe the 60% is delayed a little bit, but the 50% fully vaccinated number isn't really. And I think that's what Dr. Gale's alluding to. So we may see a little bit longer before we get to the second phase, but the third phase has probably not changed a whole lot. So it just may mean that we move from the second phase to the third phase faster than we would have, and we're in the first phase a little bit longer. Is functionally what I think is going to happen if the numbers tell us. And I was just looking at the data while we're talking.
Dr. Stoddard, we're having some audio issues. Yeah.
Yeah. So two Mondays ago, we were at 46.9%. So we functionally got up about 7% in the last 2 weeks. So that's that 3.5% number that you alluded to. And so obviously, if you take, we're 54 right now, 2 weeks, a little bit less. Perhaps, maybe, if we are truly slowed down, maybe it's 3 weeks, but I think that's roughly the timeline.
Sure, and this is where it gets harder, right? Because all of the evidence is showing that there are geopolitical dynamics at play where those in less urban, less dense areas, and this is national, right? Trend lines here in the state, but certainly nationally, are more hesitant or unlikely to get shots. And we have spent the last year, county government, making sure that those in underserved areas here in our community, urban and suburban underserved areas, had the resources that they need. And we're closing those gaps as you noted, which is a very good thing, another testament to the dedication to our belief that equity is important. But are we seeing those same trend lines regarding the geopolitical hesitation here in the county? Are there the zip codes that the underserved area or the areas that are not getting vaccinated, not because of access, but because of choice?
I think it's a combination of a lot of those factors. I don't think it's necessarily one or the other. I think there are reasons specific within each geographic location that may be a little bit different from others. I do think that there still continues to be issues of access and barriers to being able to get it. I also think that for some, there is still a little bit of hesitancy around it. And then I do think for others, there are some more political or ideological reasons behind why they're choosing not to get it. What we're trying to focus on is continuing to make sure that in any form of our operation that we have removed as many obstacles and barriers as possible. So for those who want to get it, to make it as low barrier entry points as possible for them. And for those who still have some issues around, hesitancy, prioritizing those focused campaigns that we talked about early on in the presentation. Particularly, it seems to be the sweet spot for that is whether it's hesitancy or just not coming in is in that mid 20s to mid to late 30s group. Where we're seeing lower uptake. And so figuring out that, I know that the comms team has been working over the last week to do some focused messaging to that population. And the third piece is, going very proactively and aggressively to those groups that, for example, are young people that represent thousands of individuals that do also count to the ultimate number of people covered, and would provide a great source of protection for them as they continue to move around, as well as to their other family members. And to the last piece, with those who have an ideological difference about vaccines, I think the best we can do is continue to, make opportunities available, demonstrate and show the data in terms of the effectiveness of the operation so far and the effectiveness of the vaccines. But, really focus a lot of our energy, not completely dismiss that group, but, continue to focus a lot of our energy and resources on those other populations that we mentioned where we do know that there is a significant demand for the vaccine.
I agree with that, right? Let's focus the energy on residents who want to get the vaccine but are unable to do so for a host of reasons that we have been working through throughout this crisis on various levels. But the concern that some in the community have shared with me is that the anti-vaxxers, those who choose not to, and for all intents and purposes will not on their own accord get vaccinations, that they don't hold us back in reaching our goal and doing what we have to do to return to some semblance of normal. And so it is that balancing act. And I've seen some creative things that other jurisdictions and other states are doing to try and encourage 20-year-olds to get vaccinated. And Councilmember Reamer alluded to some of them. And so certainly worth exploring more. But the bottom line is that we have dedicated ourselves over this last year to helping those who need assistance in accessing services and accessing testing and accessing vaccines. And let's continue doubling and tripling down on that to get them the help that they need so that we reach that 60% threshold and we can return to some semblance of normal here in Montgomery County. So look forward to working with you to reach those important benchmarks. And thank you again for everything that you've been doing. Thank you, Mr. President.
Thank you, Councilmember Glass. While I wait to see if any other colleagues want to speak, I'll just jump in with a couple questions I had. Maybe I missed it, but is there any update on library guidance?
Yeah, we actually had a meeting on. Yeah, I was gonna say we had. Sorry, I was struggling to get unmuted. We did have a meeting. The county executive and
trying to be muted there.
Yeah, on Friday to discuss this. Honestly, I thought that there was going to be a final agreement on Friday, but apparently there's still a few more things to work on.
It's
still
under discussion.
Yes, it's imminent. I mean, I would describe it as imminent. It seemed to me like the last few boxes had to be checked, particularly for exactly how because they're essentially, without just going too far into this, they're working on a sort of an appointment system to help. We don't want people to be turned away when they come to libraries because there are too many people in accessing the library based on the occupancy limitations, and so we want to make sure that there's opportunity for people to know when they show up that they're going to be able to come in, and there's going to be sort of an appointment model for computer time and things like that. And so there were some details on that were still being worked out as of Friday in terms of the cleaning of stations and things like that. And so those are the last few details that need to be worked out. So I know we've said this for a couple of times, but based on my meeting with the county executive, met with libraries and rec, and I was privy to that meeting. It is incredibly close to being done.
Okay. Well, actually, there's been commentary on social media about why are they different than, say, retail bookstores. And you just answered part of the question of we want people to be able to access a computer and access some of the additional services that are there that aren't available in retail stores. Is that the
Right? That's exactly. I mean, and those are the areas, because we know that, for example, computer use. There are not many other venues that have computer use, and so we know that that's one of the more popular services offered by the libraries, and becomes one of the key bottlenecks where you have too many people coming to access that particular service. Not less from a safety perspective, but rather the resident coming and not being able to utilize the service that they've come all the way out to utilize, and figure out exactly how we can make sure that can be done both safely and not having people turned away when they arrive and things like that. So we're really trying to work on how, that was the systems that we had to work through and make sure that those were in place, and also that the employees were comfortable with how those were operating. And so those are the last things that were being worked on.
Okay, avoiding resident frustration by missed appointments and stuff. Right. Okay, services not being available. Thanks. I should thank you for the good news around the homebound population, and thanks for the outreach over the phone as well. The other thing that just occurred to me, maybe you addressed this too, but once our vaccination percentage relies on the percentage of eligible residents that are vaccinated, not all residents. Once 12-year-olds and up are eligible, no, Dr. Gales, correct me.
It's all residents.
All residents.
But it actually works in our favor, because what's going to happen next week is that 3 to 4% of our population, if the CDC approves, the FDA approves, that will become eligible that weren't. And so we do use the full population numbers. And so we could actually see a spike as early as next week or the following week when younger adults become eligible.
That's my question. I remember the debate. Thanks for correcting my memory. Okay, because those are related. Okay, any other colleagues that have a question, want to speak? We were behind and now we've caught up. Great. Okay. Thanks for all your great work for our residents. We really appreciate it.